A very warm welcome to all of you. At the outset, let me congratulate each and every one of you for clearing your exams and walking into final year. It's a good job, well done. Sad that we are not yet able to meet face to face because of the COVID situation. Okay, so this is going to be your first lecture from the Department of General Dentistry. It is dealing with the development of communication skills. A short and sweet topic, very easy to understand. It's basically what you've been doing ever since you entered the clinics. You're always in a state of learning. So these skills actually have to be learned over a period of time. It comes with practice and very important because if you're able to communicate efficiently with the patient, half the battle is won. Once you're able to establish a good rapport with the patient starts confiding more in you, starts getting more comfortable, so the anxiety levels reduce, and it's a win-win situation for all. Yeah. So we shall begin. So communication is essentially the transfer of ideas or information from one person to the other. So in this case right now I am communicating with all of you. So I am going to be transferring a set of ideas and the message of today's lecture to you. So it involves 5 basic elements, this process of communication. So the 5 are the sender. So in this case I am the sender. Today's lecture will be the message which has to be conveyed to you. You are the receivers. The channel which we are using right now is a combination of audio and visual. So audio is the voice which you are hearing, that is mine, and the visual is the slides which are in front of you. And of course feedback is the doubts and the discussion sessions which we have at the end of the lectures. So if we would have been having it in the lecture room, it would have been it would have been like face to face, but now you can if you have any doubts or queries, you can always post it in the comment section in the e-portal, or you can post it in the Google Classroom, wherever you feel comfortable. Yeah. So if there is a breach in communication, it is probably because of the breakdown in one of these elements. Yeah. So it could be because the sender, that is the speaker, is not well versed with it, or is not confident enough, or maybe the message is not clear, maybe there is a problem in the channel, so maybe there is some disturbance in the audio, or maybe the video is not playing well, maybe the receivers are not very attentive, so they're not able to take back all the information which they're supposed to. Yeah. So the breakdown can happen at any of these elements. So basically let's talk about the sender. So from the sender's perspective, he or she should possess the skill to compose the message, and should be able to send the message to the receiver. So these are the two most important points which the sender has to be aware of. So he also has to choose a channel. So unfortunately we don't have much of a choice now, so we have only the audio visual. So in this case, yeah, for you to receive the message, so you should be skillful enough to compose the message. So you should know what has to be included in the message, what should be deleted from the message, and you should know how to put the message across. Now the sender is the originator of the message. So this message is coming from me. My objective should be clearly defined. So that is the learning objectives which you should be able to which I should be able to fulfill by the end of this lecture. I should know the interests and the needs of the audience. So I know that it should be a sweet and short message, so that you're all still interested and not half asleep by the time the lecture is over. I'm using the proper channels of communication in this case, and I should know my abilities and my limitations. So of course I'm not perfect. I know that I cannot accomplish everything which I have to. I know what my restrictions are in my abilities, so I'll do the best I can. Yeah. So the message which has to be conveyed, it should be in line. So I cannot just go around beating around the bush, or I cannot just speak anything which is not relative to the subject at hand. It should be based on the felt need. So right now the need of the hour is the development of communication skills, so I should be talking about that. I should be clear and understandable. I hope I am audible enough, and I hope that the slides are good enough for you to understand. I should be specific and accurate, so I should keep close track of the amount of time I'm investing in this. I shouldn't go, rattling on for a long time. It should be timely and adequate. I try to make my lectures as interesting as possible, so that I can keep the audience, that is you guys, engrossed in it, and it should be an appropriate message for the public. So if we were having a lecture in the lecture hall, it would have been a face-to-face communication, so that would have had the more personal touch, because you could actually see me and you could actually interact with me at an easier level. The other ways are to use digital software, so you can use TVs, electronic equipment, you can even use dramas to convey the message. So that is why, whenever there are special dental events, we tend to hold skits or plays, or we conduct events so that the general public can become more attempts. Yeah. So you are the receivers. You should be able to understand what was said. I hope you guys are able to grasp what I'm trying to pass on to you guys. The third point is the most common point for not being able to understand. It is because of the lack of interest or attention. Can't blame you guys. It happens to everyone. No one is perfect. Yeah, but all we can do is make an effort to try to be more attentive. Yeah. So you have to understand that when you come to attend a lecture, you should come without any assumptions. So you shouldn't come with the intent of assuming that whatever the speaker is saying is totally wrong or totally right. So you should have an open mind. You should try to be an active listener. So you should be able to grasp what is being said, and you should place biases aside. So it happens more than often, that if you don't like someone and you're forced to sit in the lecture, there is a strong possibility that you won't be sitting with interest, or you'll be trying to find fault with the lecture. I hope that's. So the audience, it may be controlled or it may be uncontrolled. So the controlled is like what we have when we hold lectures in schools and colleges. The uncontrolled is when a group of people, they gather more because of curiosity. So this can be when a play is conducted in public, that is on the streets or on the roads, and people have gathered to find out what's going on. Now, the feedback, I'm sure you're all very well aware, because at the end of your terms, you do give feedbacks about your lecturers. So I'm sure you're all aware of how it. Okay, so now coming to the types of communication. The communication can be broken down by types, the direction, the mode, and the various aids which you can use to coming to the types of communication. It can be either one-way and two-way, verbal and non-verbal, formal and informal, and written. This I'm going to be discussing with in the future. So the one-way communication is also known as didactic. It is the flow of information only from the sender to the receiver. Yeah. So this is the kind of communication which I am doing with you guys right now. It's only one way, because we are not having any active interaction or participation from your end. So in this situation, most of the time the learning is authoritative, because I'm just imposing my knowledge on you. You are not actively participating. Yes. So that is the drawback of the two-way is the more preferred of the two. So when we are in a classroom, we always encourage active participation, because as and when you ask doubts, you learn side by side. So the learning is much more active, and it more likely influences your way of thinking. That is what is meant by behavior over here. So it shapes your behavioral processes. Yeah. Now coming to verbal and non-verbal communication, unfortunately I will not be able to demonstrate the non-verbal communications, but it's something which all of you do during your lectures, so I'm sure you're all very familiar with it. Please note that non-verbal signals are also as important as your verbals, because more often than not, it is easier to grasp the non-verbal signals by a speaker when he is conducting a lecture or when he is giving a speech, So he is able to understand whether the audience is actually listening or whether the audience is showing disinterest. Yeah. So the verbal signals, I'm sure you're all familiar with. It's like you understand. I mean, you acknowledge that you have understood, or you acknowledge that you don't understand. Silence also is a verbal signal more often than not, which is practiced in the lectures. Coming to the formal and informal, I'm sure you're very familiar. So basically all the lectures which we have is the formal communication. The informal communication is all the discussions which you have among colleagues and friends. A PBL can be considered as a combination of the two, because although the lecturers are present during the PBL, we do not interact, so it is still an informal communication amongst colleagues and friends. Coming to your written communication, I'm sure you're all very familiar with it because you all take notes and you all write mails and letters. So you're all very familiar with what written communication is. It is a very good form of communication because it is actually recorded and documented. So it kind of becomes like a permanent impression, because you can take it home with you and you can use it for ages until you lose it or you destroy it. Yeah, so it is a very powerful form. Coming to your communication aids, so you can have either auditory, you can have visual, or you can have a combination of both. So right now we are actually having a combination of the auditory, that is the voice which you can hear, which is my voice, and the visual, that is the slides of the presentation. So your auditory aids, they are based on the principles of sound. So the most common examples, I'm sure you're familiar with all of them: the radios, the microphones, gramophones, tape recorders. The visual aids, they can be either projected or non-projected. The non-projected are your black and white boards, your charts and posters, and the projected aids, which I'm sure you're all familiar with, which are present in your lecture halls, that is your overhead projector, your film strips, etc. Yeah, and the slides which you're using. Now, the combination of the audio-visual, this is the best example of what you're having right now. There is your lecture. It is the combination of your audio-visual. So, a television, your computers, anything which has the combination of audio and visual are a good example. Now, coming to the barriers which doctors face while communicating with patients. Now, from the doctor's end, it could be because of lack of specific knowledge. So this happens when you are in your learning stages, and when a patient, he asks you doubts which you are not able to answer properly. So the communication happens, can break down at that point when you're not able to convince the patient, or when you're not able to educate the patient sufficiently. So don't take it to heart, because you're still in the learning phase. This is how we all learn. Nobody was born with all the information. So that could be the lack of knowledge. Counseling skill, this of course comes with experience, so you cannot master it in one day. So you have to learn how to counsel the patient. Mind you, once you learn how to counsel the patient, you have actually gained advertisement for life, because they will speak only good of you in the time to come. And if you are if you have limited time, so this also happens when you have a lot of patients, who are waiting in the reception for treatment, and you have to deal with all of them. So you are bound by time, so you cannot invest as much time as you would like, or how much time the patient would like. So because of which your communication gets restricted, and if you don't have appropriate resources by which you can. So the first few minutes are the most important, because that is when the concentration is at the peak for the audience. So try not to be late, because it gives a bad impression. Concentrate fully and only on the patient. So make sure that you are giving your patient your entire concentration. See, you have to remember that the patient might be the 10th or the 15th patient for you on that day, but for that patient, you are the first and you are the most important person in that area. So you have to try and give that individual attention. Yeah, although it may be taxing for you, you have to make an effort. You have to take care of the patient's comfort. The more comfortable the patient is, the lesser the anxiety and the more the communication and the success of your treatment. Organize your environment so that it may not be very stressful for the patient. So try to keep all the sharps away from the patient when you are trying to discuss, so that the patient doesn't feel anxious. Pay attention to the physical distance. So try not to be too close or too far from the patient. You have to establish boundaries, and you should be audible enough, you should be clear enough, and make sure you introduce yourself. It adds that personal touch to the patient, so the patient becomes and feels a lot more comfortable than dealing with a. So developing your patient communication skills, so you have to develop both your verbal and non-verbal communication, the examples of which I had given before in the previous slides. So you have to learn how to welcome the patient. So you have to make eye contact, you should smile, you should be polite, shake hands. Of course, the shaking of hands is not possible always because of the cultural boundaries, but you can always make eye contact, you can smile, you can be polite. You can position your height to align your eyes with the same level as the patient's. That is, when the patient and you both are seated, the patient on the dental chair and you on your dental stool, try to be on the same eye level. That gives a sense of warmth and compassion. Address them by their name, that gives the personal touch, so they feel more comfortable and you're not just another number for them or just another patient for them. Try to make the patient feel more comfortable. Smile more often than not. It always gives a sense of relief to the patient. Invite the patient to sit in the dental chair, ensure their comfort levels. So this is what I was trying to explain earlier also. Okay. uh, yeah, so you have to be polite at all times. You should ask why have you come to see me today, or what can I do for you today. Be as courteous as you can. How may I help you, and what can I do for you, etc. and etc. Yeah, so when you're discussing the problems with the patient, you should try to find out what exactly they are concerned with. So that becomes your chief complaint. You can ask the patient to prioritize their concerns, so then you can address those concerns according to the order of the patient. And you should always ask the patient for their opinion as to what they want. So in your practice, if you are doing a particular treatment, always lay down the options ranging from no treatment offered to the different kinds of treatment which can be considered for that particular problem. Let the patient have a say, so that the patient feels that it is not a total dominating situation, so that the patient also has the freedom to express the patient's views and to choose what they feel is the best solution. You of course have the right to voice your opinion. You have the right to say that no, in a very polite way, that this may not be the best situation for the best treatment for you, but I will do it if this is what you want. So always let the patient have the freedom to. You have to understand that when the patient is actually expressing their concern, it may sound routine to you because you would have heard it n number of times, but try your best not to interrupt the patient, because when you interrupt the patient, you may come across as rude. Yeah, so although the patient, like I said before, maybe your 10th or your 20th or even your 50th patient, you know, for the same day, but you are the first doctor. You may be the first doctor whom the patient is interacting with. So please be patient enough and kind enough to let the patient complete his or her story, his or her grievance. Yeah. And yeah, maintaining of eye contact, this I've already told you, it will be at eye level. Try to adapt similar postures, gestures and expressions. This is just so that you make the patient. Try to speak in the words of the patient. This is easier said than done. It's just so that you're trying to go out of your way to make the patient feel a little more comfortable in your practice. You have to be a little empathetic to the patient. So you have to, you shouldn't just treat it like an illness. You should actually have compassion, and you should try to share feelings with the patient. It sounds a little frustrating when you're doing it again and again on a daily basis, but it's something which you have to learn to do. Yeah, it works wonders for your practice. Your patient actually feels that half the problems are solved when you meet a compassionate doctor. And if the patient asks you questions which are not related to your dental practice, please do not try to express surprise, and uh, do not try to give the expression saying that, hey, what are you asking, I'm a dentist, I'm not like doctor, I'm not supposed to be dealing with those kind of problems. So what you can do is you can very politely you can say that I totally understand that this is a problem which you're facing. Unfortunately, I'm not the best person who is supposed to be dealing with it. So may I refer you to a physician or to a specialist? Yeah, and maybe you can refer the patient to one of your known friends or doctors, and then of course you can bring back the topic to your dental and every now and then before you carry out the treatment, try to check if the patient understands what has been discussed, so that this is also very important for preventing your medical legal cases. So if the patient understands and is on board with whatever you're going to do, the chances of the patient filing a suit are minimal or nil. So it's the best way to actually safeguard yourself. So just before you start your treatment, just confirm once whether the patient actually knows what you're going to be doing. Try to create an opportunity for the patient to ask questions. This is actually a double benefit, because if you are able to answer the questions of the patient, then the patient actually gains more confidence in you. So that actually wins half the battle for you. Also, when you are able to answer the question, it boosts up your self confidence as well. Yeah, so it has plus points on both sides. However, for you to be able to answer the question, you of course have to read first and you have to know your subject. So that of course comes with time. It's not acquired in one day. Yeah, so you have to keep at it. So your keys to successful communication are: you always have to be courteous, be consistent and clear in your message, listen. Listening is actually an art, and although today the world is moving at a fast pace, uh, we see a lot of people who don't exactly have the time to actually listen and show interest in other people's lives. So it is actually a lost art. So maybe you can replenish it into the world. So try to listen to what others have to say. Try to show a little interest, although it may sound boring and monotonous to you. Yeah. So this is what I was saying. Patients who are made to feel at ease and are encouraged to talk freely, they are more likely to discuss the real reason for them in the first place. So this is the take-home message. Both you and the doctor can participate, and you as the doctor, both you and the patient can participate in the discussion and planning for the treatment. It's always better to have the patient on board. Increase the knowledge of health and understanding among the patients, so they will act as your best forms of advertisement. So they'll say that they're actually going to a very learned doctor who is always there to answer queries and who really knows what he or she is doing. And you should try to treat your patients in a humanistic and adult manner. So try to be and try not to forego ethics. So that's about it. Like I said, it's a very short lecture, very short and sweet. If you have any doubts, please feel free to post your comments. If you feel that you want to ask it separately, you can post a private message. You can also ask doubts in your Google Classrooms, which have been started up for you. Okay, so I hope to meet you guys soon. I know it's been a long wait. Sitting at home can't exactly be very entertaining, although I hope you're getting to spend quality time with your friends and family at home. So okay, all right then. So that's it from my side. Take care, stay safe, hope to see you guys soon. Okay.